Well, I tell some people it's almost like having a migraine headache in the bladder. So think of having kind of more or less constant pain or discomfort where you feel like you have to urinate and then you urinate and then you feel better for a little bit and then it starts coming back. So kind of always in the back of your mind. And it can range like anything else from more mild to more severe, but some people make it so they can't work. They may have trouble sleeping if they're waking up to urinate all the time, and so it can have an absolutely devastating impact on quality of life. Well, there are guidelines that outline that. Most of the treatments are off-label or not indicated for IC. The treatments are, none of them I would say are universally effective, so it's a bit of trying something. If it doesn't work, trying something else. So I guess the bottom line is we really need more therapies and more research into identifying what causes IC as well, so we can do a better job of targeting therapies. Well, one thing I talked about in my talk is from my research background with the MAP network, we've identified, we have data that suggests that when patients have widespread pain, so in other words, they have their bladder pain and pain elsewhere, that systemic therapies, certain medications, for example, look like they work better. And in patients who only have pain in the bladder area, that more local therapies work better. But that's all based on kind of secondary analyses. And so I think what I'm excited to see someone do is set up a trial, a prospective trial, where they examine that issue. Well, it's bigger than I thought it would be, so it's a nice sized meeting, and on the other hand, it's not so big that you can interact and talk with people, which is nice. A really broad spectrum of what I'd call all-stars in the field, which was also nice to see. And then some other folks who just I didn't realize would be here and getting a chance to catch up. And I think what bringing back is, well, from the sessions I've learned a number of things that I'll bring back, is as you tend to do at talks, but I think these have been a little maybe better quality than sometimes. So there's things I say, oh, well, I'm going to write that down, that type of thing.